Ready to unpack this whole metformin and pregnancy thing? Seems like everyone's talking about it, but the research is all over the place.
Yeah, it's definitely a hot topic, and for good reason.
Totally. We've got some great sources to dig into. Dr. Praveen Ramachandra's editorial, Metformin in Gestational Diabetes, a balancing act of efficacy and safety. And a huge review from Nature Reviews Endocrinology all about metformin and gestational diabetes.
Sounds like a good mix.
We'll try to sort through it all, figure out what the science actually says.
And what it means for moms and babies.
Exactly. Before we get into metformin specifically, though,
Yeah.
can we do a quick recap on gestational diabetes? GDM.
For sure, a little refresher never hurts. GDM basically means your blood sugar goes kind of haywire during pregnancy,
Yeah.
and it's more common than people realize.
Really? How common are we talking?
Globally, it affects about 14% of pregnancies.
Wow. So like 1 in 7. That's a lot higher than I would have thought.
It is,
Yeah?
yeah, and that's a pretty significant number.
So why is it such a big deal then? What makes GDM so risky?
Well, for one thing, it can lead to complications
Oh, I bet.
for both mom and baby,
Right.
both during the pregnancy and even later in life.
Okay, so short-term and long-term,
Exactly. For moms, GDM increases the chances of preeclampsia.
which is
That's high blood pressure during pregnancy,
right.
which can be super dangerous. It can also make labor and delivery harder.
Gotcha. So definitely not something you want to mess with. What about for the baby? What are the risks there?
Babies born to moms with GDM have a higher chance of being larger than average.
Okay.
It's called macrosomia.
Macrosomia.
Yeah, and that can lead to birth injuries
I see.
or even make a C-section necessary. They can also have problems with low blood sugar after birth. That's called neonatal hypoglycemia.
Okay, so it's more than just about mom's blood sugar then. It's about protecting the baby too.
Exactly. And the risks don't stop there. GDM also increases mom's chances of developing type 2 diabetes later on.
Oh, wow.
And her child has a higher risk of obesity and metabolic issues down the road.
So really a lifelong concern. Okay, so we've established GDM is serious business,
Definitely.
short-term and long-term,
Yeah.
which brings us to metformin.
Right.
I think most people just think of it as like a diabetes drug.
Uh-huh.
But from what I've seen in the research you gave me, it seems like metformin is a lot more than that.
You're absolutely right. It's a really fascinating molecule, actually.
Interesting.
It works on so many different levels. You know, most drugs have a really specific target,
Okay.
but metformin, it's kind of like a Swiss Army knife of medications. It has its fingers in all sorts of pies.
Okay. I'm intrigued now. So how does it actually work? Like on a cellular level, you said it does more than just lower blood sugar, right?
Right. So essentially, metformin flips a switch in your cells called AMPK, which is kind of like a master regulator of energy.
Okay.
So once that switch is flipped, all sorts of things start happening. It's like your cells suddenly become way better at using energy,
Right.
which is great for managing blood sugar.
So metformin gives your cells like a metabolic boost.
Exactly. And that boost has this ripple effect throughout the whole body.
Okay.
One of the big things metformin does is it reduces how much glucose your liver produces.
Yeah.
At the same time, it makes your tissues more sensitive to insulin,
Uh-huh.
so they can use insulin more effectively to take up glucose from your blood.
Oh, I see. So it's like a two-pronged attack on high blood sugar.
Exactly. It tackles both the supply side
Mm-hmm.
and the demand side of the equation.
Smart.
But that's not all effect. Metformin also helps prevent fat from building up in the liver.
Okay, so we're talking liver health, blood sugar control. Is there anything this stuff doesn't do?
Well, there's even more. It even affects the gut-brain axis.
Wait, the what? The gut-brain axis?
Yeah, it's the communication highway between your gut and your brain.
Okay, I did not know that was a thing. Tell me more about that.
It's pretty cool, actually. Metformin can influence those hunger hormones.
Oh, wow.
Like ghrelin, which tells you you're hungry,
Right.
and PYY, which makes you feel full.
Interesting.
It also has this prebiotic effect, meaning it helps the good bacteria in your gut to grow.
So it's changing the gut microbiome, too.
Wow.
It seems like every time we peel back a layer, there's a whole other thing going on.
I know, right? And these beneficial bacteria, they produce substances called short-chain fatty acids,
Okay.
and those can actually improve insulin sensitivity even more.
Wow. So it's like a chain reaction.
Yeah.
Metformin supports the good bacteria.
Right.
Those bacteria make helpful stuff.
Uh-huh.
And then that stuff helps keep your blood sugar in check.
Exactly. It's all connected.
Wild. But okay, back to pregnancy then.
Yeah.
With all these amazing benefits,
Mm.
you'd think metformin would be a no-brainer for GDM.
Right.
But I have a feeling there's a but coming.
Haha. There There is. While metformin looks like a superhero on paper, things get a little more complicated when we're talking about pregnancy.
Right, because now we have to think about the baby, too.
Exactly.
Any potential risks there have to be taken seriously.
For sure. The good news is that compared to other diabetes medications, metformin has a pretty good safety profile.
Okay, that's good to hear.
The side effects are usually pretty mild.
Like what?
Nausea, diarrhea, or like a weird metallic taste in your mouth.
Oh,
But serious complications are really rare.
okay, that's reassuring. But I know from the research that metformin can cross the placenta,
Right.
which means the baby's getting exposed to it too. So what do we know about how that might affect the fetus?
That's the million-dollar question, isn't it? Just because something's generally safe for adults doesn't automatically make it safe for a developing baby.
Right, of course.
So right now, the FDA puts metformin in Category B for pregnancy.
Which means?
It means animal studies haven't shown any harm to the fetus,
Okay.
but there haven't been enough good studies in humans to completely rule out any risks.
So we're kind of in a gray area.
Exactly. And that's why we need more research. It's crucial. We need more data, especially those long-term studies that follow kids who were exposed to metformin in the womb
Okay.
to see if there are any lasting effects.
To see if there are any long-term effects.
Exactly. It's all about seeing the whole picture, not just what happens during pregnancy, but what might happen years down the road.
Okay, I see why that's so important.
Mm-hmm.
Speaking of long-term effects, let's talk about how well metformin actually works for GDM. Does it really live up to all the hype? Because the research seems a little iffy on that.
Yeah, you've hit the nail on the head.
Okay, good. I'm not crazy.
Haha, no, you're not. The research on how effective metformin is for treating GDM is actually pretty inconsistent.
Really?
Yeah. We've got all sorts of studies, retrospective, prospective, randomized controlled trials, meta-analyses,
Yeah, I saw all those in there.
and they don't all agree.
Well, that's not very helpful, is it?
Not really. But maybe we can break it down a bit, see what they do tell us.
Okay, sounds good. Where should we start?
Well, how about we look at a few specific studies, see what they found.
Yeah, okay.
So there's a study in 2008 by Torretti and his colleagues.
No.
They found that metformin was linked to a lower risk of babies having low blood sugar after birth
Compared to...
compared to insulin.
Okay.
Yeah. And then you've got studies by Gandhi and colleagues in 2012
Mm-hmm.
and McGrath and his group in 2016.
Okay.
They found that metformin helped reduce the number of babies born larger than average.
So far, so good.
Right. But then you have the MIG trial.
Okay, what's that?
That was a big randomized controlled trial
Okay.
published by Rowan and colleagues in 2008.
Gotcha.
And it showed that while metformin did help with weight gain during pregnancy, almost half the women in the study still ended up needing insulin.
So not a magic bullet for everyone.
Definitely not.
What about more recent research?
Well, there was a study in 2023 by Dunny and colleagues.
Okay.
It was a double-blind, placebo-controlled trial.
Oh, so the gold standard.
Exactly. And they found that metformin wasn't actually any better than a placebo for their main outcomes,
Which were?
the need for insulin and fasting blood sugar levels.
Interesting. So no difference there.
No, but there were some improvements in what they call secondary outcomes, like when insulin was needed and average blood sugar levels later in the pregnancy.
Okay.
And one more interesting thing, babies born to the moms in the metformin group,
Yeah.
they were smaller, but there was no difference in negative outcomes for the babies.
Huh. So smaller babies, but no worse outcomes. That's kind of interesting.
It is. Oh.
Okay, so it's not as straightforward as metformin works or it doesn't?
Yeah,
Seems like there are nuances to it.
totally.
Maybe it works better for certain people or in certain situations.
Right, and that kind of brings us to another point that came up in the research.
Okay, what's that?
Those long-term effects on the kids who were exposed to metformin in the womb.
Oh, right. We were talking about that earlier.
Yeah, those studies are super important to get the full picture.
And what did they find?
Well, so you've got one set of studies that followed up on the MIG trial.
Okay.
Those were published by Rowan and his group in 2011 and 2018.
Mm-hmm.
And then there's another one by Iches and colleagues in 2015. They all looked at kids at different ages. And some of those studies actually found that being exposed to metformin in the womb was linked to the kids being heavier and larger later in childhood.
So that raises some questions then.
For sure.
About those long-term effects.
Yeah. What's fascinating is that a lot of the research suggests metformin could be helpful for GDM,
Right.
but the results are kind of all over the map.
Yeah, that's what's throwing me.
Right. And this really highlights how important it is to have a more personalized approach to treatment.
Okay, so if the evidence is so mixed, Why is it so messy? Is the science just bad, or is there something else going on?
That's a great question. It's not that the science is bad, it's actually a few things all mixed together that make the evidence look so contradictory.
Okay, like what? Fill me in.
Well, first, you've got the limitations that come with observational studies.
Okay.
Those can be skewed by bias and all sorts of confounding factors.
Mm.
Things like mom's weight before she got pregnant,
Okay.
how severe her GDM is, other health conditions she might have.
Right.
All that stuff can affect the results and make it really hard to isolate the actual impact of metformin.
So it's like trying to solve a puzzle, but some of the pieces are missing.
Exactly. Then there's the issue of how metformin's actually being used,
Okay.
the doses when they start treatment, how consistently moms take the medication.
Uh-huh.
All of that can change the results too.
So even if metformin does work, it might not if it's not used the right way or at the right time?
Exactly. And then on top of all that, you have the whole GDM mystery itself.
Okay.
We still don't fully understand what causes it in every single case.
Right. It can be different for different people.
Right. It could be mainly insulin resistance or a problem with how the body's making insulin,
Okay.
or even a mix of both.
So it's complicated.
Very. Which makes it super hard to come up with a one-size-fits-all treatment approach.
It sounds like instead of asking, does metformin work?
Yeah.
We should be asking, who does it work for?
You got it. And then you also have individual factors like obesity and ethnicity
Uh-huh.
that can play a role in how someone responds to metformin.
So there's a lot of moving pieces.
It really is a very complex puzzle.
But where do we go from here? Is there any hope for getting a clearer picture of metformin's role in all of this?
I think there is. What gives me the most hope is the shift towards more personalized data analysis.
Okay.
So instead of just lumping everyone together and looking at the average effects,
Okay.
researchers are starting to dig deeper, look for patterns that might tell us who benefits most from metformin and when.
So figuring out which piece of the puzzle metformin fits into for each individual.
That's a great way to put it. One approach that I think has a ton of potential is this thing called individual patient data meta-analysis.
Try saying that 5 times fast.
I know, right? But basically, it involves taking data from a bunch of different randomized controlled trials and combining it all together.
Okay.
So you end up with this huge data set. And with all that data, they can start to see those subtle interactions between patient characteristics, treatment, and outcomes.
It's like putting together one giant puzzle,
Yeah.
but with pieces from a bunch of different boxes.
That's a perfect analogy. And that's exactly what the Metformin in Pregnancy Study Network is doing.
The what?
The Metformin in Pregnancy Study Network, MIP.
MIP-Ps. Gotcha.
They're doing these huge meta-analyses right now to answer those really important questions about how well metformin works and how safe it is during pregnancy.
So it's a global effort then.
It is, yeah. And I'm super excited to see what they find.
Me too. It sounds like the future of GDM treatment is all about this personalized, data-driven approach.
I think so. But in the meantime, what can people do now? It seems like there's still so much uncertainty about the best way to manage GDM.
That's true.
Yeah.
But there are definitely some things you can do. First and foremost, talk to your doctor.
Okay.
They can help you figure out your personal risk factors
Okay.
and make smart choices about treatment and keep a close eye on how you're doing. So it's all about open communication and working together with your doctor.
Absolutely. And remember, along with medical stuff like metformin or insulin,
Right.
lifestyle changes are a huge part of managing GDM too.
Okay.
You hear that a lot with diabetes in general.
Yeah, for sure.
But what does that actually look like for someone with GDM?
Right. What are the actual steps they can take?
Well, one of the most important things is getting regular exercise.
Okay.
Even moderate exercise, like brisk walking or swimming, can really improve insulin sensitivity
Okay.
and help regulate those blood sugar levels.
So getting those steps in is key.
It is. And diet is equally important.
Of course. What kind of diet are we talking about?
A healthy, balanced diet
Okay.
that's low in refined carbs and sugars
Gotcha.
and full of fiber fruits, vegetables, lean protein.
So basically making those healthy swaps and eating a rainbow of foods.
Exactly. It's all about nourishing your body and your baby with the good stuff.
And I guess it's not just about restricting things. It's about fueling your body with good things.
For sure. And it's worth pointing out that these lifestyle changes are beneficial for everyone.
Right. Not just pregnant women.
Right. They're the foundation for good health overall, whether you have GDM or not.
It's a good reminder that those healthy habits are always a good investment.
You got it.
Yeah.
And as we learn more about how our genes, our lifestyle, and that whole gut microbiome world all interact,
Yeah.
we'll be able to give even more personalized guidance on how to optimize health during pregnancy and beyond.
It seems like there's so much exciting research happening in this area.
There really is. But for now, let's circle back to metformin for a sec.
Okay.
We've talked about safety, effectiveness, all the challenges of studying it.
Yeah,
It's complicated.
it is. But I'm wondering about the bigger picture here, like the long-term consequences of using metformin during pregnancy.
Yeah.
It's one thing to think about the immediate effects on mom and baby,
Right.
but what about years down the line? What kind of impact might that have? You're bringing up a really important point, and it's one that often gets overlooked. When we use a medication during pregnancy,
Yeah.
we're basically starting this long-term experiment.
Okay.
And that experiment could have consequences that last a lifetime.
That's a really powerful way to think about it. It's a good reminder that we need to be very careful and thoughtful about the choices we're making.
I agree. And that's why those long-term follow-up studies are so essential.
Uh-huh.
We need to know how metformin affects the whole journey, not just the pregnancy itself,
Right.
but also how it might change the child's health as they grow.
And you mentioned earlier that some of those follow-up studies from the MIG trial
Yeah,
showed that the kids exposed to metformin in the womb might have a higher risk of being heavier and bigger later in childhood.
right. Those findings are definitely something to keep in mind.
Yeah,
And they show just how important it is to do more research in this area.
definitely.
We need to figure out if those differences are actually caused by the metformin
Right.
or if there's something else going on.
So it's complicated.
It is very. We need more data to get a clearer picture. So while we wait for more data,
Huh.
what can we do now? It feels like there's this tension between managing those immediate risks of GDM
Yeah.
and making sure we're not causing unintended problems down the road.
Exactly. It's a delicate balancing act for sure.
It is.
And it's so important to have those honest conversations about the potential risks and benefits of using metformin during pregnancy.
Right.
Women need to be part of those decisions
Mm-hmm.
and have all the information they need to make the choices that are right for them.
So shared decision-making is super crucial.
It really is, especially when it comes to something as important as pregnancy.
Absolutely. And as we move toward these more personalized approaches to GDM care,
Yeah,
those conversations are only going to become even more important.
I agree 100%. It's about finding that balance between managing those immediate risks of GDM
Uh-huh.
and minimizing any potential long-term effects.
On both mom and baby.
Right.
It sounds like this is where those personalized roadmaps for managing GDM would be really valuable.
They would. But you know what's really fascinating to me?
What's that?
Metformin's impact on the gut microbiome.
Oh, yeah. The research mentioned that, and I definitely want to hear more about it. What's the connection there between metformin and those gut bacteria and GDM?
Okay, so this is where things get really interesting. Remember how we were talking about how metformin changes the makeup of those gut bacteria?
Yeah, boosting the good guys, reducing the bad ones.
Right. Well, it turns out that this shift in the gut microbiome could be a major factor in how metformin actually affects GDM.
Really?
Yeah,
So it's more than just those hunger hormones then?
it is. It's about the whole ecosystem of bacteria that live in our gut and how metformin changes that whole balance.
So we're talking about a whole little world living inside us.
We are.
And metformin's kind of shaking things up in there.
Pretty much. And it turns out that this gut microbiome is incredibly complex.
Like that.
And it has a huge influence on our overall health.
Like how?
Everything from our metabolism to our immune system.
Mhm.
And more research is showing that it plays a role in GDM too.
Wow. So how does metformin tie into all of this?
Well, remember how we said metformin has that prebiotic effect?
Yeah, it helps the good bacteria grow.
Right. And those beneficial bacteria, they produce those short-chain fatty acids.
Mm-hmm.
And those have been linked to better insulin sensitivity.
Oh, right. We were
Right.
talking about those earlier.
Exactly. So
Yeah.
it's like a whole domino effect.
Okay, I'm following.
Metformin supports those good bacteria.
Right.
They produce helpful substances.
Mm-hmm.
And then those substances help keep your blood sugar under control.
It's like a whole team working together.
Exactly. And there's more and more evidence that this whole gut microbiome modulation thing might be one of the main ways metformin actually works on GDM.
Wow. That's really interesting. It adds a whole other layer of complexity to this.
It does. But it also opens up some really exciting possibilities for new treatment approaches.
Like what?
Well, if we can understand how metformin interacts with the gut microbiome,
Okay.
we might be able to develop some really targeted interventions that specifically enhance those good bacteria and their effects on metabolism.
So instead of just using metformin to go after blood sugar directly,
Yeah,
we could use it to change the gut microbiome and kind of indirectly improve metabolic health.
Exactly. It's a much more holistic approach to managing GDM,
Yeah.
one that takes into account all those different systems in the body and how they're connected.
And that brings us right back to personalized medicine.
It does.
If we can figure out which bacteria are the big beneficial,
Right.
we could tailor interventions for each person.
Exactly. Whether it's through diet prebiotics, even fecal transplants.
Oh, okay.
The possibilities are incredible. And research is already heading in that direction. Scientists are trying to pinpoint the specific bacteria that are linked to GDM
Wow.
and understand how they contribute to the whole thing.
It sounds like we're entering a whole new world of GDM research.
I think we are.
Yeah.
And it's a world with so much potential. The more we learn about the gut microbiome and how it affects GDM, the better we'll be able to create those targeted, personalized interventions that can really make a difference for both mom and baby.
It's definitely an exciting time to be following all this research. But for now, I think we need to take a little break.
Sounds good.
We'll continue our exploration of metformin and GDM in part 2 of this deep dive. Stay tuned.
Welcome back. It's really fascinating to dive deeper into this whole metformin puzzle, especially when you think about what it could mean for personalized GDM care.
You're right. This is where things get really interesting. Remember we were talking about how metformin's effectiveness can be different for different people,
Yeah.
depending on individual factors and just how complex GDM is in general.
Exactly. And that's actually a big part of why the research can seem so contradictory.
Yeah.
One study says yes, another says no. It's enough to make your head spin.
It can definitely feel like you're on a roller coaster sometimes.
Mm.
So how do we make sense of it all? It feels like we're caught between these studies that show positive results
Right.
and others that aren't as convincing.
Well, it's important to remember that science is always a work in progress.
Right.
It's rare that one study will give us all the answers.
Right. It's more like we're putting a puzzle together piece by piece.
That's a great way to think about it. And one of the key pieces we need to consider is risk stratification.
Risk stratification.
Mm-hmm.
That sounds kind of technical.
Yeah.
What exactly does that mean?
Basically, it means figuring out which characteristics or risk factors can help us predict how someone's going to respond to different treatments.
Okay.
So, for example, if we could identify the women who are more likely to benefit from just metformin alone,
Right.
then we could avoid giving them insulin or other interventions unnecessarily.
Okay. That makes sense. It's about tailoring the treatment to each person.
Exactly. Not just treating the GDM diagnosis in general.
So it's like personalized medicine, but for GDM.
Exactly. And research is starting to uncover some of those key risk factors. Remember that study we talked about from Portugal by Benito Silva and his colleagues?
Yeah.
They found that mom's age,
Okay.
her weight before pregnancy, and when they started metformin,
Right.
those were all clues as to whether she would end up needing insulin on top of the metformin.
So basically, if you're older, have a higher BMI, and start metformin later in your pregnancy, you're more likely to need insulin too.
That's what their data suggests.
Yeah.
And that kind of information is super helpful for doctors.
How so?
It can help them make better decisions about which treatment is the best fit for each patient.
It's like having a personalized roadmap for navigating GDM.
I love that analogy. And, as we get more and more data, those roadmaps are only going to get more detailed and accurate.
That's exciting.
It is. Imagine a future where we can use genetic testing,
Wow.
blood biomarkers, lifestyle factors to create a truly personalized treatment plan.
That would be amazing. It would take a lot of the guesswork out of it.
Right. That's the power of this research.
It sounds pretty futuristic, though. Are we really close to that?
I actually think we're closer than you might think. Research in this area is moving really fast.
That's great to hear.
And we're already seeing these personalized nutrition programs being developed for all sorts of different health conditions.
So is it more than just cutting out soda and eating your veggies now?
Uh-huh. Yeah, it goes way deeper than that.
Yeah.
It's about understanding the exact things that your body needs to thrive
Okay.
and then tailoring your diet based on that.
So personalized nutrition could really be a game changer for GDM.
I think it has that potential for sure. By combining all the latest science
Right.
with individual data, we can create a much more precise and effective approach to GDM care.
This kind of brings us back to that balancing act idea that we've been talking about.
It does.
It's not just about balancing the risks and benefits of medications like metformin.
Exactly. It's about balancing our whole approach to managing GDM,
Okay.
medications, lifestyle changes, and now potentially personalized nutrition as well.
It's like putting all the pieces of the puzzle together
It is, but making sure they're the right pieces for each individual.
and finding that right combination is what it's all about.
Exactly. There's no one magic solution that works for everybody. It's about taking this holistic, personalized approach
Okay.
that really considers each woman's unique needs and her baby's too.
Well, I think we've done a pretty good job of unpacking all the complexities of using metformin for GDM.
I agree. We've really dug into the science, explored the controversies,
Yeah,
and I think highlighted the exciting possibilities that are coming down the pipeline.
for sure. And if our listeners take away one thing from this conversation, it should be this knowledge is power.
Couldn't have said it better myself. The more you understand about GDM metformin
Right.
and all the things that affect how they interact, the better equipped you'll be to make those informed decisions about your health and your pregnancy.
Absolutely.
Yeah.
And remember, this conversation doesn't end here. Stay curious, keep asking questions,
Yeah.
and be your own health advocate.
So well said. Keep learning, keep exploring, and stay engaged in your health journey.
On that note, I think we'll wrap up part 2 of our deep dive into metformin and GDM.
Yeah.
But don't worry, we'll be back for part 3. So stay tuned.
And we're back for the final part of our deep dive into metformin and GDM.
It has been quite a journey exploring all these different facets of metformin.
It really has.
Yeah.
And I feel like we're starting to see metformin in a whole new light. It's obviously a lot more than just a simple drug to lower blood sugar.
You're absolutely right. It's a really complex molecule with all these different effects on different systems in the body.
Yeah. And as we've been talking about, those effects can be good and bad, especially when it comes to using metformin during pregnancy.
That's a really crucial point.
Oh.
There aren't any easy answers when it comes to metformin and GDM.
Right.
It's really all about weighing the potential benefits against those possible risks and making informed decisions based on the best evidence we have.
And like we've seen that evidence is always changing as new research comes out.
Exactly. Science is always moving forward. That's why it's so important to stay up to date. Speaking of new frontiers,
Yeah.
I'm super interested in this whole idea of personalized nutrition for managing GDM.
Oh, yeah. That's the exciting world of nutrigenomics.
Nutrigenomics.
Yeah. It's all about how our genes, our diet, and our health are all connected.
It's pretty mind-blowing to think that our genes can actually affect how our bodies respond to different foods.
It really is. Every single person is unique, and their genetic makeup can influence so many things.
Like what?
How they metabolize nutrients, how their gut microbiome is composed,
Okay.
even how likely they are to develop conditions like GDM.
So what does all this mean for actually managing GDM? Could we see personalized nutrition plans in the future?
I think there's a really good chance we will. Imagine getting a diet plan that's designed just for you,
Wow.
based on your genes and your gut microbiome analysis,
Okay.
to optimize your blood sugar control and support a healthy pregnancy. It'd be like having a nutritionist who knows exactly what your body needs.
That'd be amazing. It sounds almost too good to be true, though.
I know, it sounds pretty futuristic. But honestly, I think it's closer than we realize. The research in this area is moving so fast.
That's great.
We're already seeing personalized nutrition programs popping up for all sorts of health conditions.
So it's not just about cutting back on sugar and loading up on veggies anymore.
It's about going way deeper. It's about understanding exactly which dietary components your body needs to thrive
Okay.
and tailoring your eating habits around that.
So personalized nutrition could be a game changer for GDM then.
I think it definitely has the potential to be. By combining all the latest scientific knowledge with individual data,
Right.
we can make GDM care so much more precise and effective.
This kind of brings us back to that balancing act idea that keeps coming up.
It does, doesn't it?
It's not just about balancing those risks and benefits of medications like metformin.
Exactly. It's about finding that balance in our whole approach to GDM.
So medications lifestyle changes.
Right.
And now maybe even personalized nutrition.
It's about finding those pieces of the puzzle that fit for each person.
And the key is making sure you have all the right pieces.
Exactly. There isn't one solution that works for everybody. It's about taking that holistic and personalized approach
Uh-huh.
and considering what each woman needs and what's best for her baby, too.
Well, I think we've covered a lot of ground here. We've really unpacked this whole metformin for GDM thing.
We have. We've dug into the science, we've explored the controversies, and I think we've done a good job of highlighting all the exciting possibilities on the horizon.
I agree. And if our listeners take away just one thing from this whole conversation, it should be this knowledge is power.
I love that. The more you know about GDM, metformin, and all the factors that influence them,
Right?
the better decisions you'll be able to make for yourself and your pregnancy.
Couldn't have said it better myself. And remember, this conversation doesn't end here. Stay curious. Keep asking questions.
Yeah.
And be your own advocate.
Keep learning, keep exploring, and stay involved in your health journey.
Well said. On that note, I think it's time to wrap up this deep dive into the world of metformin and gestational diabetes. Thanks for joining us, and until next time, stay curious and stay informed.